Check, check. Testing one. Testing 1, 2. Mic check 1. Testing 1, 2. Testing mic check 1, 2, 3. Mic check on the east front of the United States Capitol. Getting anything at all? Testing 1, 2. Mic check 1. Testing 1, 2. Mic check. Testing 1, 2. This is a mic check in the United States Capitol. Testing 1, 2, 3. Thank you.
Guys, I need all the press people to have their congressional IDs out where we can see them. If you're not part of the congressional press corps, please go ahead and move back to the sidewalk.
Testing 1, 2. Mic check 1. Testing 1, 2. Mic check. Testing 1, 2. Mic check 1.
All right, guys, you want to get down? Everybody still, so I'll get down in front.
Testing 1, 2. Mic check 1. Testing 1, 2, 3.
I'm hoping to get a heads up. The cold weather. I'm coat and a hat on wear. Huh?
Testing 1, 2. Mic check. Test, test.
stand a step back, 2 steps.
You can be next to me. I think we just don't want any of our photos to be left. So, make sure the
Sides down below. Jeff, you can go down next to Debbie.
Tip it the other way, too.
Yeah, this is good.
Yep, they're bringing me one.
Just go a step back. Here, stand there.
One more? I see this.
Good. Great.
Senator's always watching out.
Tammy, you're right here.
yeah.
Okay, great. Okay, here, let's move it back a little so everyone can see the, move back some steps.
Up some steps so there's distance.
Yeah, so everyone can see, keep going back. Okay. All right, I want to thank all my colleagues for joining us here today. Yes. And now we're here to show what this bill means. This is not a bill of just paper and pencil. This is not just abstract numbers. These are real people. And every one of these stories represents millions of others who are also affected. We will send you a list of the 40-some-odd stories we have and their pictures. But in the 50 states, there are so many people, millions of people, who would be harmed by this bill. Whether it's cuts from Medicaid, hikes in the cost of care for people with pre-existing conditions, skyrocketing out-of-pocket costs for care. These are the faces, the human toll that Trumpcare would take on our country, our citizenry, our great American people. I'd like to talk about one of my constituents. Melba Torres. Melba was born in New York City. She lived on the Lower East Side her whole life. Here's what she told me. These are her words. Medicaid is a strong part of my existence for everyday living in every single way. I was born with cerebral palsy, have relied on a wheelchair my whole life. Day-to-day activities that most people take for granted, getting dressed in the morning, cooking meals, going grocery shopping, even getting to and from work, she works, are made possible because of Medicaid. In 2012, you may remember, Superstorm Sandy walloped the East Coast and New York City. Melba was in her apartment on the 8th floor. Because of her palsy and her wheelchair, which weighs several hundred pounds, she couldn't be evacuated. But luckily for Melba, her home health care aide walked across the bridge in Manhattan to be with her. Melba was without power and darkness, no elevator, and her home health aide probably saved her life by being able to feed her and deal with the problems that she had. Without Medicaid, Melba would probably not be here today working as a productive American citizen. This is who we're fighting for. Not some obscure government funding program, not some ideological desire to cut the safety net, not for very wealthy people. Millionaires would each gain an average of $57,000 in the tax break in this bill. We are here. We feel so passionate about this because of the pictures you see. Plain and simple. And for every one of these pictures, there are tens of thousands more in the same condition. We're here to implore our Republican colleagues, turn back from this bill. Don't take health care away from people who need it most to give a tax break to those who need it least. If they don't want to do it for Democrats, if they don't want to do it for doctors or nurses, if they don't want to do it for policy wonks who say it's a bad bill, do it for the Melbas of this world. Do it for the Melbas. So, my friends, we are fighting as hard as we can because we believe that this bill is so detrimental to so many millions of Americans, middle class, and those trying to get there. I'm now going to call on my colleague from Wisconsin, Tammy Baldwin.
I'm fine right now. So this issue to me is very personal. When I was 9 years old, I got sick. I got really sick. I was in the hospital for 3 months. Now, I eventually recovered, but when it came to health insurance, it was like I had a scarlet letter. My grandparents who raised me couldn't find a policy that would cover me, not from any insurer and not at any price. And they had to pay for much of my health care out of pocket. And they had to make enormous sacrifices to do so. All because I was a child who had been branded with those terrifying words, pre-existing condition. It wasn't just personal for me, it's personal for the Wisconsin families that I work for, like the Schomburg family in Seymour, Washington, or Wisconsin, not Washington. A few years ago, Zoe was born with a congenital heart defect. She had to have open surgery at 5 days old. This is, I had another picture of her after the surgery, but instead I have a photograph of her a few years later. Now Zoe is guaranteed to access coverage without being denied or charged more. She can ride her favorite bike around the neighborhood and she can play with her friends. But Zoe's parents are scared. They are scared that this repeal plan will make things worse. Zoe's mom, Chelsea, wrote to me. She said, "I'm pleading with you as a mother to fight for the kids in Wisconsin with pre-existing conditions that are counting on you to protect that right." When Chelsea was told about how this plan would weaken the guaranteed protections and care that people can rely on today, she said, "To me, it's like they're taking the American dream from her. It's not right, it's not fair, and it is not who we are." You might not be able to see this, but Zoe's t-shirt says, "This girl is unstoppable." And I'm fighting for her because we cannot let the Senate Republicans' plan stop her. I'm fighting for her because she cannot have her guaranteed protections repealed or weakened. I'm fighting for her and her family because they cannot afford to be thrown into a high-cost pool that will price them out of the health insurance that they have today. We must work to make things better, not pursue partisan plans to make things worse for families like the Schomburgs. The people of Wisconsin did not send me to the United States Senate to take people's health care away, and I won't stop fighting to protect the health care that people have today. Together, we must stand up for Zoe, fight for her family, and fight for every American who lays awake wondering if the health care they have today will be there tomorrow. Fight on.
Bravo. Great job. And we ask you, those of you from local papers and outlets, to talk to your senators about the person that they are holding up to represent the millions of others. We'll just take a few quick questions. Any? Okay. Then thank you very much for coming. The fight goes on. We're going to do everything we can to win this fight in the names of these people and the so many millions more they represent. Thank you.
Just takes three.
Great. You were fabulous.
That was great. Well, that's because Zoe's fabulous.
Yeah, look at her.
The fight goes on.